Hi everyone, we have our most amazing patient here today, and what we're gonna do is mid-face filler. Now she wants more apples in her cheeks, and so what we're gonna do is we're gonna put filler here and here, here and here to lift her apples up and give her more mid-face fullness and volume. The filler we're using today is called Contour, made by Restylane. It works really well in this area. It's gonna give her a great result. Okay, love you, rest your head back. Now she's an amazing, perfect person. She likes strong, dramatic looks that enhance who she is and how she wants to present herself. And that's what we're gonna do. Now what we're gonna do is we're gonna gently lift the cheek up. Then we're gonna lift it up and we're gonna go straight on the bone. Feel it. We're gonna check to make sure we're not in a blood vessel. We're not. Now we're gonna put an aliquotter product. And we're holding the cheek up so the filler sits here and gives her that adequate lift. Wow. And compare the size, it looks so dramatic. You can really see it. I'll show you. Only a half syringe. Have a look. Right versus left.
Ooh, yes.
Is that what you were thinking about?
Yes, exactly.
One of the things I really hate is when you use dull needles. It takes 5 seconds to change it, but less likely bruising, swelling, and it goes in cleaner. Now this side I added 0.45. Here, it's a little bit flatter, so I saved a little extra. I'm gonna do 0.55 here. So again, I'll gently lift this up. I'm gonna go in straight on the bone. I'm gonna check, not on a blood vessel, and gently inject.